The topic for discussion in today's presentation is what is filial therapy? What does filial therapy involve? Why do we use filial therapy? How is it used? And included in the presentation in the following slides will be some research and evidence around filial therapy. Filial therapy incorporates training and play therapy skills that are included in the play therapy sessions, as play is the child's symbolic language of self-expression and can reveal what the child has experienced, reactions to what the child has experienced, feelings about what was experienced, and what the child wishes, wants, or needs, as well as a child's unique perception of self. Filial therapy was developed in the 1960s by Bernard and Louise Gurney. Parents are taught the skill set to become the therapeutic agents of change for their own child. You'll be working with a child-centered play therapist to learn the therapist skill set required to be non-directive, to be able to create special time for play, and throughout the process, the play therapist will be supervising the therapy sessions conducted by the parent. Filial therapy is closely related to child-centered play therapy, and the goal is to help children and their families. Filial therapy is used as an early intervention approach that involves upskilling parents at a time of need in order to help understand their child's needs, and possibly their behaviors as well. It involves the parents being present for all sessions of therapy, and the parent is usually responsible for conducting the therapy session while the therapist facilitates and observes the process, giving regular feedback and transferring the play therapist's skill set onto the parents. Filial therapy usually takes 3 to 6 months to complete, but can be continued longer. In many cases, parents choose to continue the process at home when they begin to see results. It is a flexible form of therapy that can be delivered individually or as a group. As with any form of therapy, goals are identified for all parties involved in the process. Firstly, when we are looking at the goals for the child, we want the child to be able to understand their feelings and to be able to confidently express their feelings as well as their needs. We want the child to become more confident in problem solving and to feel secure within their family, as well as to develop trust and to help the family connect or bond with each other. The goals for the parents are to understand the child's emotions, worries, and fears, as well as to learn new skills. Enjoy playing with their child and give their child non-directive attention, as well as to increase their listening skills and develop their confidence as parents. To enjoy their role as parents and to form a closer, happier relationship with their child or their children at home. Filial therapy involves the therapist training, supervising, and coaching the parents in order to transfer the therapist's skill set onto the parents. The parent's role is to apply the skill set that has been taught by the therapist in order to engage in special playtime weekly with their child at home. Furthermore, the parent will be increasing their listening skills as well as encouraging cooperation from their children. Research supports the effectiveness of filial therapy with families experiencing a wide variety of social, emotional, behavioral, and learning problems, including a family whose problems are related to life stresses such as divorce, death, relocation, hospitalization, chronic illness, assimilate stressful experiences, physical and sexual abuse, domestic violence, as well as natural disasters. There are 3 elements of a filial therapy agreement, the first being the child-centered play therapist, the second the parents or the child's caregivers, and thirdly the child or the children in a case where there's more than one children that are in the family. The measurement of empathy in adult-child interactions is a scale used to separate 3 major aspects of empathy. These include communication of acceptance, allowing the child's self-direction, and involvement of the child. The highest levels of empathy are attained when all the scales are considered together and the parent is able to fully attend to the child, communicating frequently on the child's expression of feeling or behavior in a genuinely accepting manner, showing that the child is permitted to engage in the activity chosen. This is where the child is able to have self-direction and to initiate their own activities whilst the parent is involved with the child. Parental acceptance is a core element in communication of parental empathy and also an essential condition needed to facilitate a child's development of positive self-worth. A play therapist gains these results through obtaining direct observations of the interaction between the parent and the child. When families are first introduced to child-centered play therapy, one of the main questions that often comes up is, how does play help? A trained therapist can use playtime to observe and gain insights into a child's problems. The therapist can then help the child explore emotions and deal with any unresolved trauma or negative, challenging life experiences. Through play, children can learn new coping mechanisms and how to redirect any inappropriate behaviors. What is special about play with filial therapy? Play is a highly structured and theoretically based approach to therapy that builds on the normal communicative and learning process of children. Filial therapy is a therapeutic method that combines non-directive play therapy and family therapy to strengthen relationships, create healthy attachments, and prevent future family disruption. It can be more direct and a faster way of addressing challenging child-parent dynamics and associated behavior and emotional difficulties, allowing the family to develop a positive bond. What do parents do in the session? Parents are the most important people and teachers to their own children. We help the parents and caregivers to understand their child's world and experiences through play. This is where children reveal their underlying issues and motivations, process their pain, and develop solutions and understandings of their feelings. Parents also learn that they have undivided attention to their child, which is a key component to understanding their child and strengthening their relationship. The emphasis of family therapy and training is to show parents how to be aware of and be sensitive to their child's emotional needs, along with how to respond to those needs therapeutically and with empathy. What problems can filial therapy help with? Filial therapy has been implemented with many different populations, including two-parent families, foster parents or caregivers, single parents, parents of different nationalities, parents of mentally challenged children, and parents of chronically ill children, parents of children demonstrating conduct problems, as well as parents of children with learning difficulties, and non-offending parents of sexually abused children. In addition, other dynamics also involve parents that have been recently separated or have gone through a divorce, or families that have experienced grief and loss.